Hello, hello, hello. Welcome to Power in Nursing with the PowerRN. Today, we're going to just have a moment of fun. Want to talk today a little bit about one of her favorite subjects. We're going to talk today a little bit about COVID. Now, most of you're healthcare providers, or you know some healthcare providers very closely, and you've heard about COVID and the pandemic, and the US is having a little trouble with the response to managing the pandemic and trying to stem the cross contamination and the virus and how that can hygiene. And we've talked about farther away from folks than you normally have. And that measure is about 6 feet. But in the meantime, things are getting out of control. I know the numbers are going up every moment that we're alive here. And the numbers have exceeded 3 million infections that have been noted. And that doesn't include the folks who don't know they have it or haven't been tested. So, one of the treatment strategies, again, kind of reasonable. Nurses and healthcare providers, we're used to wearing masks and washing our hands and using sanitizer, but some of the folks in our community aren't so used to doing that. And so it has been a struggle for some people to rely on a place in their life where they haven't been before. And social distancing has been a challenge for folks. And they want to get out and they just want to be free and they want to go back to normal for us, normal before the pandemic, to think, okay, well, I'm just opening this door from this room to that room. Maybe I can not wash my hands. No, no, that doesn't work. Maybe I just got the mail out of my mailbox and I put it in my mail slot, and maybe I'll just go and get the remote control and turn on the TV. No, no, I've got to wash my hands. Oh, now here we are with this pandemic, and covering your face has been a mandate that's been put in place for several states. Now, we know that there is no overarching federal strategy, but covering your face has been one that has been put in place for many of the states, facial covering, and they are stressing about that. We will put on a mask and wear it for 8, 9, 10, 4 hours, take care of our patients, have lines, in our faces, and we keep going and we don't eat. And here we're asking for social distancing and wearing a face mask. So, the funniest thing has happened. Folks who are stressed about wearing the face mask, they believe it's not good for them, and they have chosen to ask for an exception. And we'll call that a face mask exception. I call it a little kooky myself, but I'm a nurse, so that's what I say. A face mask exception. I have seen examples of folks going to their physician to ask for a face mask exception or order or prescription, whichever you want to call it. And many of the doctors have had a chance to talk to some of their clients about the way that the face mask would be used and how it would protect other people. But some of us are kind, and some of us are considerate, and some of us are thoughtful, and then there's everybody else. So they struggle, those folks struggle, and they are screaming. There's been an incident in a Target where a woman apparently tore the whole scene down where the face masks were put out for display and purchase. And I've heard that story at other places. And then we have folks who are not wearing their mask, even though there's a mandate in their area and or it is presented as a helpful strategy. They say they won't wear it because they don't like it or they just don't believe in it and they it because of whatever reason and they don't want to wear it. So doctors have done their part. And then there are other folks who are so helpful, apparently, for their particular scene, and they have created from wearing a face mask, and that's called a face mask exemption. These are cards that they carry in their purses, and they say these will be presented to whatever business that they go to that has a sign on the door that says face masks are required. So they'll pull a little card out of their purse or out of and let that be known. Them feel threatened. They don't have to wear because they will get CO2, oh, carbon dioxide poisoning because the carbon dioxide won't be able to get out of the space between the mask and them rebreathing. And they will die of carbon dioxide poisoning. Now, I'm not going to ask you if that's true, but I'm going to say I don't believe the germs that you and I might carry. I may be asymptomatic. I don't know it. I don't have any symptoms, and I need to go to pick up my prescriptions from the drugstore. So I will go to the drugstore, and whether it's drive up or inside, and then I would come out of the store and get back into my car. After sanitizing, I will take off my mask as I'm in the car by myself. And I haven't exposed anyone else to any germs. You know, most times we might know when we're going to cough, maybe, but when you're going to sneeze, it just comes upon you. So we need to be protected and we need to protect other exemption cards. And some of them are produced, as says, by the DOJ, Department of Justice. Let me know that those are fake, they are frauds. And they're also presented by the persons that are carrying these items to vendors or the store owners that have someone with their exemption. Please don't get fooled. There is no such thing as a face mask exemption. Don't be fooled. Wear your mask, adjust your mask so that it isn't so tight that it strangles you till your eyeballs pop to be comfortable or comfortable. They're almost one size fits all. But having said, well, I know we have to wear masks and I have to pick up my prescriptions. So I'll don my mask and I'll go pick up my prescriptions and then I'll go back home. The mask isn't intended for you to wear 24/7, 365. It need to do only what you need to do. Don't stay out 6 hours and go have to wear us because you don't know that you have the virus and you have been exposed. So thank you so much for taking this time or as facial covering use or face masks. Do us a favor, save a life. Save your mom's life. Save your grandmother's life. Okay? So for you young people, just be thoughtful, doctor. Give them a call and let them help you understand why it's necessary for you to follow the mandate and the guidelines. And yes, I know that we know that sometimes they change daily onto someone else's body who may have comorbidities and may die from that one big sneeze of a passenger entered the bus. Come on, be a part of the solution. Be a part of the solution and help the healthcare workers not have to work until they drop. They're now going from New York and from the Northeast down to the Southern 16-hour shifts, 3, 4, 5, 6, 7, 8, 9, 10 days in a row, serving in the ICUs to care for those who have been infected. Give us a hand and help us. Help us out and help yourself. Be blessed, be well,